Hello everyone, my name is Steven Castellanos and I'm here to present you our product Core. We save lives through innovative solutions. How are we composed? Well, we are composed by four biomedical engineering students, a biomaterial expert, Dr. Carolina Munoz, and a cardiovascular surgeon, Carlos Perez. Now, which is the problem that we intend to solve? Well, cardiovascular diseases are the leading cause of death worldwide. Approximately 30% of all deaths are due to this kind of diseases, and one third of all of them require surgery, being open heart surgeries the most dominant in this area. From these open heart surgeries, one of the most prevalent is the replacement of the aortic valve. The aortic valve connects the aorta and the heart, and because of age and bad habits, it may accumulate a lot of calcium. If it happens, it needs to be replaced. However, during these kind of procedures, small pieces of calcium may generate, as small as shown in the picture, and may migrate to two little holes called the coronary ostia, which are in the aortic valve. If this happens, there is a high risk of heart attack, neurological events, and the death of the patient. And today, there's nothing in the market to reduce this high risk. So we need a way to prevent cardiovascular events in the coronary ostia to reduce the risk of complications during procedures involving access to the aortic artery. But what do we propose for this? Well, we propose CORE. That is the first easy to apply sticker for open heart surgeries that require access to the aortic valve. It is a biocompatible bioadhesive with adhesion properties to cardiac tissue to protect the coronary ostia by putting it in their surface. The general idea is to have a medical device to put core in the surface of the coronary ostia before replacing the aortic valve, for it to protect them from any particle. We had two final prototypes, the medical device to put core and core by itself composed of collagen and chitosan. The collagen gives him cohesivity and hardness for it not to break during this procedure, and the chitosan gives him adhesiveness to the heart tissue. We warn that the next slides contain sensitive content, so viewer discretion is advised. So we did a final validation with the cardiovascular surgeon Carlos Perez with porcine hearts. Here you can see core in the surface of the coronary ostia. And we did a simulated wash with a blue liquid where core demonstrated good adherence to the cardiac tissue. And it demonstrated good protection of the coronary ostia because when using core, coronary arteries were clean, different when not using core because they were blue. So with core, we have a technology that adapts to the morphology of the coronary ostia, that has low interference with the surgical field, and that protects the coronary ostia from any particle. But how do we intend to sell our product? Well, we proposed a B2B business model where we had to cross by first through suppliers, then investors, then the distributions, then the buyers, which would be the insurance companies and the healthcare providers, and the final users, which are cardiovascular surgeons. Now, who would be interested? Well, this solution would be of high interest for medical device marketers and also for healthcare providers because this solution would avoid extra costs ranging from $2,000 to $15,000 per day of care due to associated complications such as heart attacks. And for this problem, what is in the market? Well, we did a market analysis where we find a lot of technologies for closed heart surgeries. However, there are no solutions for open heart surgeries in the market or in any patent database. So we have a product that is very innovative because it lowers the risks during these procedures, because it's easy to use, and because offers a standardized procedures for protecting the coronary ostia. And how does the future looks like? Well, it looks so well because of the high market size of this kind of procedures. We expect to have a high profit in the next years, not only in Colombia but internationally. Then we conclude that we have identified a clear development opportunity, that we have preliminary validation for the effectiveness of core, that we have a great market potential, and that we are so innovative because there is nothing in the world for protecting the coronary arteries during open heart surgeries. Now, how do we move from here? Well, we need to trade more in the technology for make it more safe for its application. We need to protect intellectual property, then do the corresponding preclinical validation, cross regulatory pathways for medical devices, and finally do the corresponding technology surveillance analysis. So, with your help, let's give every heart the chance to keep beating. Thank you.